My name is Anna Kamp. I'm a pediatric electrophysiologist from Nationwide Children's Hospital and The Ohio State University in Columbus, Ohio. I have presented a talk on the up-to-date management of atrial tachyarrhythmias in adults with congenital heart disease at the International Academy of Cardiology annual scientific sessions held in Boston. Today we discuss the high incidence and prevalence of atrial tachyarrhythmias in adults with congenital heart disease, and discuss that heart failure and arrhythmias are major determinants of death in this population. Arrhythmias are the most common and most frequent reason for hospital admission in adults with congenital heart disease, and an estimated 50% of patients with congenital heart disease will develop atrial tachyarrhythmias by the time they are age 20 years. So in discussion of how to care for these patients and how to manage them, we have reviewed the PACES and HRS expert consensus statement on the diagnosis and management of atrial tachyarrhythmias or of arrhythmias in adults with congenital heart disease. We have focused on the class 1 indications of adults with congenital heart disease being cared for in coordination with a regional center for adult congenital heart disease, and we have discussed the collaboration of procedures that be done in regional centers with who specialize in the care of adults with congenital heart disease. We have focused on patients with mustard repairs and patients with Fontan palliation, as those patients are known to have a high prevalence of atrial tachyarrhythmias. The management of those atrial tachyarrhythmias are often limited by sinus node disease, and the atrial tachyarrhythmias are clinically made worse by intact and robust AV node conduction. We've reviewed medical management of atrial tachyarrhythmias in the adult congenital population, of which there's very little data, but one must consider AV node function and sinus node function in considering medical management options. In the setting of significant ventricular dysfunction and complex atrial flutter, amiodarone is to be considered first-line therapy, though may be considered second-line therapy in the setting of preserved ventricular function. There are very little data for adults with congenital heart disease and their medical management, and monitoring for these patients is important, as many patients are asymptomatic. There are new technologies available, including the new generation of implantable loop recorders, which are smaller, have a longer battery life, and allow for better transmission. Our institution has recently reported data on 22 adults with congenital heart disease whom were implanted with the new generation Medtronic links, and in that data we discussed 40% of patients were found to have actionable events on the implantable loop recorder. 50% of patients with Fontan palliation were found to have clinically significant events on their implantable loop recorder, which changed management. In addition, we discussed new advances in ablation technologies, including high density mapping catheters and image integration with 3D mapping systems, and we discussed results from our center of recent use of high density mapping catheter, which demonstrated a shorter procedure time, decreased fluoroscopy time, and also decreased number of access sites needed for the procedure. In summary, adults with congenital heart disease are known to have a high prevalence of atrial tachyarrhythmias. There are new technologies, including the Link ILR, as well as new ablation technologies, including the high-density mapping catheters and 3D image integration, which improve surveillance for these arrhythmias and improve outcomes for these arrhythmias.